Traditional and conventional care, cultural differences and their impact on health. This photo shows a community level interaction where traditional medicine and local healing practices exist alongside conventional health services. In the image, a health worker / traditional practitioner is assisting a woman in an outdoor setting. The setting and attire suggest a locally based herbal / traditional practice integrated with community care. And this matters. The image captures non-clinical care spaces, community trust in local healers, and the physical presence of accessible, culturally familiar care. The differences depicted are the preference for traditional / herbal remedies over or alongside biomedical treatments, healthcare delivered in community / family-centered contexts rather than strictly in hospitals, spiritual / sociocultural framing of illness and healing. Illness may include spiritual causes, and a fun fact from the source is in African studies, a large portion of the population uses traditional medicine regularly. Ghana has made policies to integrate traditional medicine into the health system. How these differences influence healthcare. Impacts on interactions and outcomes, decision making. Patients may choose traditional remedies first, delaying biomedical care for acute conditions, which can change the outcomes. Communication, different explanatory models create potential misunderstandings between providers and patients. Adherence and safety, combining herbal remedies with prescription drugs can cause interactions if providers don't ask about traditional medicine use. Access and equity, integrating trained traditional practitioners can increase access in rural, undeserved areas. Barriers and facilitators to culturally competent care. Barriers include provider assumptions that biomedical care is always preferred, lack of provider training about cultural practices, distrust or stigma toward traditional healers within formal systems, communication gaps including language, health literacy, and explanatory models. And some facilitators include policy level integration and regulation. Some examples exist in Ghana where traditional medicine is being incorporated. Collaborative relationships between biomedical providers and respected community healers, standard screening questions about use of herbal / traditional treatments in patient histories, community health workers who bridge cultural contexts. Practical strategies to recognize and promote cultural competence. At the individual clinician level, ask respectfully about traditional remedies and beliefs in non-judgmental phrasing. Use cultural humility. Ask, what do you believe is causing this, rather than assuming what's going on. Include family / community if the patient wants them involved in their decisions. At the system level, train clinicians on common local traditional practices in common herb-drug interactions. Create referral pathways or joint clinics where licensed traditional practitioners can coordinate with biomedical teams. Use interpreters and culturally congruent health workers to improve their communication. These strategies are aligned with WHO recommends supporting integration and collaboration. Personal reflection, assumptions, and biases. This image has taught me that I assumed evidence-based care always meant hospitals and prescriptions, but the image highlights how cultural trust, accessibility, and meaning shape real choices. I recognized a bias toward equating non-clinical and less effective. The WHO documentation shows traditional care is widely used and increasingly integrated, which invites respect and thoughtful collaboration rather than dismissal. My takeaway is that culturally competent care respects local healing practices, asks about them openly, and seeks collaboration when safe and appropriate. Encouraging training and respectful dialogue improves outcomes and equity. My call to action for clinicians and students is start every patient conversation with curiosity about traditional remedies and decision influences, then integrate that knowledge into the care plan. These are my references.